Welcome to this week's episode of Hormones, Metabolism, and You. I'm your host, Dr. Cassie Smith. I'm a functional medicine endocrinologist. I'm so happy that you're here today. We are going to talk today about how to make our kids resilient. So, on this podcast, we talk all the time about gut health and overall wellness and what we can do as adults to become healthier. But today, I have an amazing woman who is an integrative pediatric specialist who really focuses on the resilience of our children. So, if you want to know the key to raising resilient kids from the inside out, this groundbreaking evidence guide to helping kids in our modern world, written by Dr. Elisa Song, called Healthy Kids, Happy Kids, is a book that bridges the gap between conventional and holistic pediatrics and delivers a clear roadmap to help kids thrive. So I brought her on because she has this book that is absolutely fascinating. She talks about raising healthy and happy kids in the modern world. She says it shouldn't be so hard. Yet, despite living in what should be the golden age of medicine, our children are sicker than ever, just like adults. At least 1 in 5 kids have eczema, 1 in 10 have asthma, ADHD, or anxiety, and sometimes they have all of the above. Many parents are at a loss for who to turn to for trusted advice that takes a root cause, holistic approach, and to the whole child resilience, but don't dismiss the value of conventional pediatrics. And so her whole goal in writing this book was to just give parents somewhere they could turn where they could look for holistic causes for things with their kids. She has an amazing, backstory as to how she got here. She has tons and tons and tons of experience. She's been a pediatric practitioner for 25 years. And throughout this interview, we really talked about how to create a microbiome. She calls it a magic microbiome to optimize your child's microbiome in 5 simple steps that you already do. We talked about how to empower your kids to make healthy choices. So, teach your kids how to read food labels and teach your kids why it's important to eat healthy foods. And we talk about small ways that you can do that. So, you can't take a kid, she gave an example of a kid, you can't take a kid from eating a tater tot to eating broccoli. And so, how do we get kids to trade their tater tots and their french fries for vegetables? We talked about kids with food aversions and what we can do in that scenario. We talked about, as a parent, what you can do to help your kids make healthy food choices. And it's not to nag them. And so there are ways that we can do that because kids pick up on their parent and the adult around them's energy and vibes. She talks about how to heal your kid's gut to get to the root cause of their chronic health concerns. And like I said, kids are just the amount of chronic health concerns in children and gut issues are astronomical. And so she gives all of these tips. She has in her book 25 acute childhood ailments that most parents reach for antibiotics or things to treat. And she talks about a more holistic way that you can treat those things. And she actually pointed out that in 2005, the New England Journal of Medicine published an article. And for the first time ever in 2005, it said that our kids are actually expected to live shorter lifespans than their parents. And so that's alarming. And nobody's done anything to change that. And her point is like, why? And so we really dive into gut, which is what I love as well. So we talked a lot about why your child's gut microbiome holds the key for longevity and for resilience. She gave us a list of medications that you really want to try to avoid in kids. And some of them are very similar to adults. And some of them may be shocking to you. So you'll have to listen to the episode for that. We talked about how 70% of the time kids are given antibiotics, they really don't need them. And again, we focus on food labels. We focus on the things that disrupt our kids' microbiome. We talked a lot about the vagus nerve and stress and what that does to children. I've told you guys about what it does to adults, but what it can do to children can even be more detrimental. And we talked a little bit about vaccines at the end too. I kind of slid that in there. So are vaccines good? Are they not? Should we be doing different schedules? So she gave me her advice on that. So we really talked a lot about in general, just our kids and like, why are they getting sicker? And what do we do as parents to try to make them more resilient? So I hope that you listened to this entire interview. It was absolutely phenomenal. So here we go. Please allow me to introduce you to my guest today, Dr. Elisa Song. She's a Stanford, NYU, US, UCSF trained integrative pediatrician and functional medicine expert, and most importantly, a mother of 2 thriving children. She's dedicated her career to helping parents and practitioners bridge the gap between conventional and holistic pediatrics with an evidence based, pediatrician backed, parent approved approach. Dr. Song has lectured around the world and has been featured in hundreds of top podcasts, print, and online media outlets, including the Wellness Mama podcast, Bloom TV, Forbes, Healthline, Mind Body Green, National Geographic's, Pop Sugar, Parents, Motherly, Very Well Health, and New York Post. So now let's get into our conversation about how to keep our kids resilient and the best thing we can do as parents to keep them healthy and happy throughout their life. Welcome back to this week's episode of Back to the Basics. I'm thrilled that you joined us today. You're in for a treat. We're actually going to be talking about kids today. So something a little different from our typical podcast stuff, but it's going to be similar to what I talked to you guys about. So I have Dr. Song, and I asked her to come on because she does what I do, but in kids. So everything that we talk about, if you've listened and you thought, oh my gosh, can my kid do this? Or what should I do to help my kid's gut? Or, how can I help my kid be more functionally healthy? She has all the answers. She wrote this amazing book, which I am lucky enough to have a signed copy of. Healthy Kids, Happy Kids. And so it's wonderful. I think it's so helpful. If you're a parent, you definitely need to get it. But she kind of explains, just like in adults, in kids, at least 1 out of 5 kids have eczema, 1 out of 10 have asthma, ADHD, or anxiety. And they're kind of getting worse, right, Dr. Song? They're not getting better. So I guess, can you kind of give us a grave overview of what kids' health looks like, and then maybe like how you started this process into like holistic healthcare for kids?
Yeah. And it is kind of grave if we really step back and think about it, because now it's probably at least around 1 in 2 kids has some sort of a chronic diagnosis, and that's just one. And when we think about it, oftentimes kids with eczema also have asthma, and they also have allergies, and maybe tip over into autoimmunity, or they have anxiety, and the list goes on and on. And really, worth looking at now, it was 20 years ago in 2005 when the New England Journal of Medicine wrote an article where they were predicting lifespans. And it was noted that for the very first time in history ever, our kids were expected to have shorter lifespans than us, their parents. And that should have been a huge wake up call. Like, what is going on? In this day of, medical miracles and modern medicine, and our kids are expected to live shorter lives than us. And then we also have to think about the quality of that life. So it is so important to really take that functional medicine, integrative medicine approach that, as you said, you take for adults. We can 100% apply it to children, and we need to, so that we can reverse what's going on.
Yeah, no, I completely agree. And so I think what parents are going to start asking is like, well, what are the main things that we can do? So I think where I want to start is like the microbiome, right? So you talk about in your book this like microbiome magic and ways to optimize your kids' microbiome with like 5 easy steps. So kind of talk to us about that. Like, what can we do from a microbiome standpoint, or why are our kids, let's start with this. Why are our kids' microbiomes so bad?
Well, for folks who listen to your podcast and work with you and know anything about functional medicine, that there's this phrase, all disease starts in the gut, that Hippocrates was credited with saying. That is especially true for children, because the way that your child's microbiome shapes and develops, especially in the first few years of life, those very formative years, really informs how their immune system will function. We know that disruption to the gut microbiome early on can disrupt the gut immune system connection and significantly increase the risk for your kids developing eczema or asthma or any allergic disease. And then we think about the gut brain connection. And if you have kids, that when they're babies or they're toddlers, you literally every day are like, oh my gosh, they're a different kid. Their brain is exploding, right? Well, that brain explosion of connections is really informed by how their gut microbiome is also exploding in their microbiome diversity and function. And any disruption to the gut microbiome early on can also significantly increase the risk for mental health concerns in your kids by the time they're older, whether they're older kids or teenagers. And we know we have an epidemic of anxiety. We've had that and it's worsening. And the question that you asked is so important. How do our kids' microbiomes become disrupted? Because if we know how they become disrupted, then we know as parents and practitioners where to intervene, right? Where can we move the needle and make a difference? The number one reason for kind of immediate acute disruption to the microbiome are antibiotics, and not just antibiotics, but medications in general, because we now know that, there are many, many medications besides antibiotics. And I'm including also actually in this pile endocrine disruptors, right? Environmental toxins. All of these are known to have a significant effect on your gut microbiome negatively. And in fact, many medications will preferentially kill off the good bacteria, your probiotics in your gut, and keep the not such good things like maybe too much Klebsiella or Citrobacter, which are not bacteria we want to have a lot of, or an overgrowth of yeast or whatever it might be. Other medications that can really disrupt the microbiome include things like antacid medications or um, uh, antihistamines, both of which are and steroids, which are very commonly used in childhood. And then as they get older, our young girls, our teenagers who are on birth control pills, that can disrupt the gut microbiome. And then for their anxiety, they're placed on SSRI antidepressants. So we have medications, but there are also other factors, because sometimes these medications, we need them, right? And so, a lot of times there are other ways that we can manage. But we know our standard American diet, all of these ultra processed foods and the food additives, and there's a category of processed chemicals called emulsifiers, which are things that are put into food to keep your food from becoming a goopy mess. And you will find them, your kids will find them, if we teach them how to look, in protein bars, in ice cream, in, ketchup and barbecue sauces and salad dressings, even the ones that look, quote, healthy, right? Even in liquid infant formula. And so we have to be savvy as parents. And then I think another area that a lot of not enough people are talking about is the impact on the microbiome of chronic psychological stress. And that is an area that is so important, even in our little ones, of course, our middle school and high schoolers, and even for us as adults. Psychological stress can can actually trigger leaky gut and can cause an abnormal balance of bacteria to overgrow, called gut dysbiosis for the listeners. And so figuring out where in this picture we can intervene as parents and also educate and empower our kids is really important. We need to make, as you said, I call it microbiome magic in the book. We need to make microbiome magic a daily thing so that whatever comes your way, whether it's an unavoidable round of medications or it's, a high stress time at home or at school, their microbiomes stay more resilient and they can bounce back from whatever's going on.
Yeah. So what I heard you say is what I tell all adults too, right? So antibiotics are the huge disruptor of gut health, especially in kids. And when you think about kids, I have parents tell me this all the time. Well, my kid's always sick, so they need antibiotics. No, they usually don't. They usually have viruses. And what they need is for you to fix their gut so that they get a good immune system, right? And they can fight these things off. But antibiotics, antacids, so we talk about this in adults, how terrible it is because it changes the pH of your stomach. And when your stomach pH changes, a lot of things get into our GI tract that we don't want there. And then it also changes how we digest food. So we get more bad bacterial overgrowth like staph and strep down in our gut. And so that causes issues. You said antihistamines. So these are like allergy medications for people listening. If your kid's on a lot of, alert or Allegra, Benadryl, things like that. These are antihistamines, Pepcid, steroids too. Like you said, so many, I live in Oklahoma. The weather here is wild. We have terrible allergies. And so lots of people are on steroids. And then to your point, birth control. So I talk about this all the time. So many teenagers are put on birth control because they have irregular menstrual cycles or painful periods or they have acne. And instead of really like pulling back the covers and figuring out why is this happening, what are the causes, which a lot of times are our diet or lack of sleep or high insulin or cortisol and stress, we just give kids medicine just like we do adults. But that long term is not good. And so that's a problem. And I think that, you have this whole section in your book, which I love. I bookmarked it. So again, another reason for you guys to get her book, but she has this whole section towards the back where she talks about integrative pediatric approach, the top 25 acute childhood concerns. And she goes through like, well, what do I do if my kid has an earache? And what are their, what things can I give them for crud or for colds or flus or respiratory issues that aren't antibiotics? And so it's very helpful. This is even helpful for adults, like, because there are a lot of adults that want, antibiotics.
Oh yeah, yeah, yeah. I mean, and to your point, the antibiotics. I mean, you said most of the time kids don't need those antibiotics because the vast majority of infections they have are viral respiratory infections, viral stomach flus, whatever it is. And in some studies, up to 70% of antibiotic prescriptions written for kids were inappropriately prescribed. And so I'm not saying never ever do antibiotics. There is a time and a place. It's just that most of the time, if we step back, antibiotic prescriptions are more likely a prescription of convenience in a busy practice or a busy ER, and not really going to A, help your kids get better faster because chances are they have a virus, and B, there can be long-term consequences to their gut microbiome, which then increase their risk later on of developing, mental health concerns or immune concerns. And so we need to, if your child is on antibiotics, even if it's way in the past, we want to think, okay, how do I restore their microbiome? That's the first and most important thing, because if you restore their microbiome, just like for adult patients, a lot of things fall into place. And for kids, they actually fall back into place easier, faster, because they don't have those years of toxicity building up like adults do, right?
Yeah. So talk to me about, I want to go back to the vagus nerve at some point, but we can finish this conversation. The 5 things that create a microbiome magic everyday, whole gut resilience program that you talk about in the book. Can you kind of explain that to people, this 5 steps that you can take to help your kid fix their microbiome? Because again, for listeners, if you're thinking, oh my gosh, this doesn't apply to me, I'm not a child or have one, this pretty much applies to adults too. But so go ahead.
Yeah, yeah, absolutely. Well, and I want this to be a family affair. I've had teenagers and adults read parts of the book and be like, wow, I didn't realize that, even though I thought I was living a really healthy lifestyle and eating, really clean, I didn't realize that even for me, there were little tweaks I could make that are simple, practical, doable, that can really create even more balance and resilience to my microbiome. So I call them the 5 things for microbiome magic. And if you look, there's a diagram of a wheel, and the 5 things are in a wheel, because in a wheel, it doesn't matter where you start, right? You just start somewhere and the wheel keeps moving forward. And these 5 things, I did not want to, I mean, I'm a mom myself. I have teenage kids, and we don't want to add on more to your plate as a kid or a teenager or as an adult. And so these 5 things are 5 things that we already do every single day. But if we learn how to do them in a way that creates microbiome magic, we will be so much healthier and happier now and on into the future. So the first part is nourish, which is how we feed ourselves and our microbiome. And food matters. Within just a matter of days of eating an ultra processed standard American diet, your microbiome shifts for the worse. On the other hand, just a couple of days of eating a clean, more gut friendly diet can shift your microbiome back to a healthier pattern. So it really matters. And
I
yeah, so
found
we
it.
have those 5 things, right? So when
Yay.
we think about, what we want to eat, we have to think about, there's 2 parts to this. What do you want to get in? What do you want to keep out? And, for some families, it might be easier to think about what you keep out because, for instance, if you have a kiddo who, is very picky and you're like, there's no way I'm going to get anything green on their plate right now. Well, okay, that's okay. If they're eating mostly packaged foods, then keeping out is one of the most important things. And I teach in the book how to learn how to be a food label gut hero detective, right? This is a skill that all kids, teenagers, and adults should have. And even when we're buying something that says organic or, gluten free or whole grain or whatever it is, you have to turn the package over and look at the back and look to see how much added sugar there is. Look at the ingredient list, identify. I have a list of the top food additives to avoid that really wreak microbiome havoc. And I give really concrete examples. Like, for instance, my son, his friends, Takis are all the thing, the artificial red dye monosodium glutamate rolled corn tortilla chips that I wish they would just ban from the market. But his friends eat Takis and he knows that he doesn't feel well after he eats Takis, except, he still wants them because his friends go out. Now he's a teenager and they'll go out and get lunch and, get a bag of chips with their lunch. And so we've gone through the exercise of, okay, let's look at labels. I would like you to be able to enjoy chips with your friends, but how about let's pick something that tastes just as good and is not going to be harmful for your gut microbiome or your brain. And so in the book, I give examples of literally what we did. Like we looked at Takis and you could see all of the ingredients. You're like, oh my gosh, there's 50 ingredients in here. And it says artificial and dye and all the things, right? And then, you move over and Trader Joe's, which a lot of people have Trader Joe's in their neighborhoods. They have a rolled corn tortilla chip, chili lime flavor. That's better. It's cleaner, right? It still has some seed oils and it's not perfect, but it's better. Like if that's his choice, right? If that's what he has. But then you move over to there's Pockies and then the Siete and even better, right? So the Siete Fuego chips, right? So he can then learn how to make those choices, whether it's a bag of chips he's looking for or whether it's a hydration drink that he's looking for that's not Gatorade or Prime or whatever other junk that's on the market, right? So learning how to be savvy because at some point he's going to be out of the home. He is now, right? He's making his own choices, but at some point he is going to be making all of his grocery shopping decisions on his own. So I think teaching your kids how to read food labels is one of the most important life skills that we can give as we kind of push them out the door. And then, if we're thinking about what we want to get we in the book I call them microbiome champions. So really thinking about how do we, in a fun way, make your meals pop with plants on purpose. So just each meal, what do our microbiome champions are fiber, phytonutrients, which is color, and fermented foods. So every meal, how can we make it pop with another plant? Because these are all plant-based foods that our microbiome needs. So if you're having a bowl of oatmeal in the morning, great. How about adding some like pumpkin seeds on there, some dried raisins? If you have, some flax seeds, a lot of us have these things in our cupboard. We're just not thinking of putting them on because we're kind of in a rush. So then just pause, make it pop a little, and that's going to help your gut microbiome.
Yeah. I like that. Yeah. So more of a, and I agree with that. Like a lot of people will tell me like, well, my kids definitely won't eat that. They won't eat that. They won't. Well, then avoid some things. I like that. So instead of focusing on what trying to force them to eat, we'll just make sure we're not giving them a bunch of toxins. Because if you don't give them a bunch of toxins, they don't have to clear it. And then I also like how you talk about, the steps. So breathing is really important, which brings us back to the vagus nerve. So I was going to say when you were talking about the vagus nerve, I have a book that's going to come out this year too. And it's sort of similar to this, but it's based on the theory of the book, or what we talk about, is how everything, including hormones, affects your gut. So it's very tied to gut health, but it's teaching people how testosterone and estrogen and melatonin and insulin and cortisol, all the things it does to your gut. Because a lot of people don't realize that, right? So like, when you go through menopause, it changes your gut. One of the things I talk about in the book, though, is how I was so shocked last year to find all of these people who have pretty good looking guts. I do gut studies, right? So they don't have a ton of, it doesn't look awful, but they have a terribly leaky gut. So their zonulin is sky high, their secretory IgA is sometimes low, and they just have this terrible leaky gut appearance, sometimes dysbiosis, but not always. And when I look at their labs, everything is pretty good. These aren't insulin resistant people. They might not even have Hashimoto's, but these are type A, attorney, doctor, stressed out people who just like stress, literally, I can show you, will just kill your gut. And a lot of these people have significant constipation or diarrhea issues, which goes with vagus nerve issues. And so I have a health coach that they work with now who literally will just make them think about like chewing their food 15 times and taking, breaths before eating and different things like that. And you will, like, the things that I hear from these people, it's shocking. Like, my constipation went away. And it's all because your vagus nerve is so, like, it innervates your whole gut, right? And your hormones play a part in that too. So when you have this whole section in your book about the vagus nerve, I was intrigued with that because I was like, yes, I see this in adults all the time. And it makes sense too, right? Like a lot of kids who have just debilitating anxiety and depression, a lot of times, if you think about it, they'll have a lot of gut issues too, right? They'll either have issues where they don't want to eat, or when they eat, their stomach hurts, or they're having diarrhea. And so, to your point, I think, we don't think about how much this stress or everything subconsciously or what we're doing actually affects our gut, which is why I wanted to write this book. So talk about that a little bit more, like the vagus nerve, and then we can talk about why breathing and relaxing and mindset is so important for building this resilient microbiome.
I can't wait for your book. I mean, it's so important, and I love that you have a health coach that's dedicated to really working with parents, with adults on this, because we need to really, as practitioners, emphasize that one of the most important prescriptions you can give as a practitioner is vagus nerve work. I mean, that will pull a lot of the pieces together. So work on your microbiome, work on your vagus nerve. I mean, those are the two priorities. And instead of trying to, fine tune and correct every single, nutrient imbalance, or, every single organic acid marker that's off, focus on those things. And psychological stress can trigger zonulin release within an hour. It's fascinating. And so, we're looking at all of these other, toxins and foods and things. Absolutely, we need to look at those. But when we're looking at psychological stress, that is one of the areas that we need to focus on for our kids and for our teenagers and for our parents, because so many parents in my practice have not learned how to manage stress in a healthy way. And so it's going to be virtually impossible to help their kids learn how to manage stress in an appropriate way. And I mean, the other thing too that I have a whole chapter on the vagus nerve in my book. It's that important. And I always emphasize with kids and with parents that stress is not a bad thing in and of itself, right? Just like, we talk about how inflammation it's not a bad thing. It's just that when we have too much of it, right? And there's a reason to have some stress. And I feel, nowadays there's so much stress avoidance. Oh, I don't want my kids to be stressed. Stress is so bad. I'm so stressed. Well, stress is your body telling you, okay, you're getting ready for something. But when that thing happens, then you just have to learn how to manage that and balance out your fight or flight stress response with your parasympathetic vagus nerve rest, digest, and restore response. And when we look at something called heart rate variability, which I'm sure many of your listeners are familiar with, maybe they have an Aura ring that tracks it, or they have a Whoop or their Apple Watch, right? But heart rate variability is one of the best markers that we have to look at vagus nerve functioning. It's also one of the best predictors of current and future health, even for children. And what we found, there's actually a cardiologist who, starting in the 80s, started looking at heart rate variabilities in children and followed them through the decades. So it's a short period of time, but he found that even in that short period of time, our kids in overall heart rate variabilities have been declining. Our vagus nerves are not working as well as it should. And I'm sure the same thing is happening with adults. And when our heart rate variability and our vagus nerve are not working appropriately, that has a direct impact on the gut microbiome. on the flip side, what's fascinating is when we can improve heart rate variability in children and do more vagus nerve work, that's been found to improve gut microbiome diversity and functioning in children independent of diet. And I love that, right? I'm not saying you can eat all the junk you want and meditate your way out of it, right? But it's still, if you're like, oh, I don't know if I can change your diet yet, then don't create more stress in your life. Work on some of these other tools. And a lot of the tools that we use to engage your vagus nerve, they're free. You can do them anywhere, anytime. I mean, there are some devices that I might recommend, for kids who, really need to have their vagus nerve pushed a little bit more. But things like breath work, as you said, chewing and breathing before you eat, um, being mindful and just aware, um, walking in nature. There's gratitude and journaling. There's tapping, emotional freedom technique. You can learn how to use cognitive behavioral tools. One of my favorite series of books is by one of my friends. She's a psychologist, Dawn Hebner, and she wrote a whole series of what to do books for kids, kind of like self-help books for kids, to teach them cognitive behavioral tools. And CBT has been shown to also improve heart rate variability. Her first book was called What to Do When You Worry Too Much. And even parents, when they read it, they're like, oh, I'm going to use these tools for myself, right? So I don't even call it for kids now mindfulness or meditation, because still, unfortunately, in this day and age, that puts it on the realm for most people as that's kind of an optional. I'm going to do that later. First, I want to take the supplements, right? And so I really explain to kids what their vagus nerve is, how important it is, in age appropriate terms, and say, look, this prescription to do vagus nerve work every day is one of the best ways to get healthier and also stay healthier, right? Because I'm sure, I mean, we all as functional medicine practitioners will see patients where, yay, we've fixed their gut, we've given supplements, maybe their autoimmunity has been reversed and they feel great, but then the stress starts creeping back in, and all the things, and and the symptoms start coming back, right? So if you want lasting healing, whether you're a kid or adult, the vagus nerve is that missing piece. It is the piece that we really need to prioritize.
Yeah, no, I couldn't agree more. And the more like functional medicine I get into, the sicker patients that come to you, and I'm privileged, blessed, and sometimes frustrated with some of the people that come, right? Because it's like I've seen 10 doctors. And I mean, I have some really, really sick patients sometimes. And what I find is that a lot of times those really, really sick patients have a lot of vagus nerve work to do. And if you ask them questions, and this is what I tell people. So if you're listening to this right now, think about the answer to these questions. Today, currently, have you checked in with yourself? And by that, I mean, have you said to yourself, Cassie, how do you feel today? Have you taken 1 minute to say, are you hydrated? Did you get enough sleep? Does anything hurt? Are you hungry? Do like people don't normally do that, especially women. We're really bad about it. And so when I started actually doing these things, because I never did this either, right? One of my favorite things to do is set somewhere. It doesn't matter. You can do this anywhere. Sometimes I do it at work. Like when I have a second, set somewhere, and I literally in my mind, like think, okay, my right little toe, I feel that. And then my fourth toe, and then my third toe, and then my second toe, and then my first toe, and then my foot, and then my ankle, and then my calf. Like just literally feel every single part of your body, but think about it. And sometimes you're like, wow, my back really hurts, or but we just go, like we never really let all that set in. And that's not a good thing, right? To your point, it can be a good thing for a day or two, but a lot of people have become accustomed to that and just not listening to that. And the other point is like when you actually start doing vagus nerve work and getting better, I tell people this all the time, like you'll be shocked, like your body actually absorbs nutrients, and it absorbs all those expensive supplements that you're taking, and it absorbs your protein and all those hormones I'm giving you and all the peptide, whatever you're putting in your body. If your vagus nerve is never allowed to relax, then you're not going to absorb most of that anyway. So it's kind of a waste of time, right? Like it's, and so I tell people this all the time, like, unless your vagus nerve can calm down and take that, and it's just really sad because to your point, like, I think that we have all these kids that are in this like go, 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 go because of social media and because of their parents and because their parents never learned, so I'm a functional medicine endocrinologist. I just kind of got in the functional medicine space 2 years ago, but until I was about 36 years old, I never did any of that either. I never went to yoga. I never meditated. I never did breath work. I sure as heck never sat and asked myself how I felt. Like, it's just like go, 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 go. And when you start doing it, it's just very interesting how different you feel, right? It's just so different. Like, prime example, I am a morning workout person, right? I work out about 5 to 6 days a week. I just do. I always have. I lift weights. Have a trainer. This morning, I'm not even kidding you, I woke up at like 5:15. I normally wake up without an alarm. I woke up at 5:15 this morning and I set up and I was like, I just don't feel very good. And so I went and sat in front of my red light like I normally do. And I read a scripture. Like I have a scripture that I read every morning. And then when I was done, I was just like sitting there and I was like, my back hurts and my arm hurts and my shoulder hurts. And I was just kind of thinking, and I was like, I worked out pretty hard on Sunday and Monday and Tuesday. And I just hadn't really taken a day off. And so I literally picked up my phone and I texted my trainer and I said, I'm not going to come today. I'm happy to pay you, but I just don't feel well. I think I'm going to stretch. And so I did some yoga this morning and I kind of stretched. And I'm so happy that I did because I have a busy day and I feel so much better. 3 years ago, I would have been like, I'm going, like, doesn't matter. I'm going. I'm going to go lift weights. Yeah. And so, like, as an adult, you have to kind of start listening to your body and doing that. And because of that, like I said, my stress level has been not high this morning. I feel great. I probably digested my breakfast much better. But you have to like actually listen to yourself. And the problem is, I think that I say this all the time, like if you don't listen to your body when it whispers, you're going to be in big trouble when it starts screaming. Right. And I think that there's just so much noise, that we don't listen, or we have so many things to do. And then kids see that, unfortunately, right? So kids are like sponges and everything you do, they want to do, right? And so to your point, like if adults don't know how to deal with their stress, they don't know how to read food labels, your kids are going to, that's what they're going to see. That's what they're going to do. Right. And they're going to internalize a lot of that too. Right. Like and so it's just, I think it's so important, not only for adults, but obviously for kids too, because this is our generation of the people that are going to take care of us, right? And so we want them to be healthy and happy, and we obviously want better for them than ourselves, right? Most parents, that's what they'll tell you, but it's like we have to teach them a lot of this, right? And so your vagus nerve is so important, like so important.
It's so important. I'm so glad you're bringing awareness to this, and I love that idea of just sitting and noticing your whole body, from your toes all the way to the top of your head, because that is something that, children in general, when they're younger, are less in tune with their sensations and maybe don't recognize when they're getting hungry or when they're full or when they're tired. But as they get older, if we start to teach them how to tune in, check in, and really notice what feels right for them, what doesn't, it helps them to make better informed decisions about whatever they're choosing, whether they're choosing, a boba tea or to stay up, all night because they want to, chat with their friends or play video games or whatever it is. If we have them be aware of just paying attention to when they do X, Y, or Z, how does my brain and my body feel? And if it's I feel great, okay, we know that. If it's I feel sluggish and I'm cranky and I'm not so good the next day, then at least they can make an informed decision when they choose to, do whatever it is that probably we're cringing at, but eventually they have to make their own decisions. And so I love that. I love, having them really pay attention. That's part of just being aware of what's going on around you and being able to stop and be in the moment and pay attention to your body and your surroundings, because we don't do that enough. As you said, we're just kind of running around and not listening to our internal cues and our external cues, and eventually we pay for it.
Yeah. So, from a kid's perspective, like, I talk on this podcast a lot about adults. So, I say, yoga or even just stretching, going for a walk outside. I call it tea time with Cassie, where I just sat like 3 minutes and, how are you feeling? Did you have your supplements? Are you thirsty? Do you need, just asking yourself questions like, what else? Is there anything different that kids can do? Like, what do you recommend for kids as far as like working on their vagus nerve?
Mm. So, I mean, we need to make it fun and, not long, right? Because, to have kids sit there and think that they're going to do 30 minutes of meditation, I mean, that even feels long for me, right? And so, just really trying to, and also not something that is, that takes them away from a lot of their activities. So what I mean by that is we want to have it be something you can incorporate in your everyday routines. So, having a gratitude practice at nighttime where you just go through all the things that went really well during the day, because our brains, unfortunately, have a negativity bias where we tend to remember the negative way more than the positive. So really prioritizing that. There's a fun exercise too that you can do this. It's called a rose, a thorn, and a bud. It's really having kids think, okay, what were some of the roses today? What were some of the really great things that happened that made me feel good, made me feel happy? What were the thorns? And there's probably, for some kids, there's lots of thorns, right? Because they tend to see everything glass half empty. All right, let's talk about the thorns. Now let's see, what are the buds in this whole opportunity. These are the opportunities that arose a lot of times because of those thorns, right? And so, just shifting their mindset to really focusing on, some of the uh, brighter opportunities. And what's really interesting, even from an epigenetic standpoint. So, many of your listeners are familiar with epigenetics. Our genes are not written in stone. It's what we put into our bodies, our brains, what we drink, eat, all of that we're exposed to that can shift how certain genes will either work for us or against us. And the power of mindset and the power of being able to see something positive, even in a negative situation, some silver lining, that's actually been shown to positively affect your epigenetics and reduce in children the risks of later developing things like diabetes or cardiovascular disease. It's fascinating. So we can't just, we don't want to dismiss when something awful has happened, but at the same time, we don't want to sit and just reinforce that over and over again, right? So that's one thing you can do. One of the most important things I think that kids and adults, for that matter, can learn how to do is just breathe the right way. And breathing, the chapter is called Breathe, because we have to breathe every day. But most of us are not breathing in a way that engages our vagus nerve. And when we think about our vagus nerve and well, what happens when we're stressed out, pupils dilate, heart starts to beat faster, blood pressure goes up a little bit, and our sympathetic nervous system is activated. Now, when our vagus nerve kicks in, our heart rate starts to slow down. Pupils can start, constricting to a normal level, right? But you cannot tell your pupils to get smaller or your heart rate to slow down, right? There's nothing you can do in that moment to tell your vagus nerve, I need you to kick in, except for your breath. Diaphragmatic belly breathing breath work is the only direct line to your vagus nerve that you actually have control over. Because immediately by slowing down your breath, not breathing with your shoulders, expanding the balloon in your belly when you're breathing fully in slowly and exhaling, you're deflating the balloon fully. Simply slowing your breath kicks in your vagus nerve, your heart rate starts to slow down, and we start to feel more calm. So if we can learn how to do that, you're breathing all the time. It doesn't look different. Kids don't have to go to another room and sit and meditate. Nobody has to know what they're doing if they're stressed that a friend just sent them a mean text, or maybe they have an exam or a baseball game and they're super anxious about it. They just have to sit there and learn how to engage their breath, slow it down. And this is where paying attention, as you said, to your body, going inward into your lungs and really imagining everything fully expanding and then everything fully deflating. And that is really, it's so powerful, and yet it's so simple. And it's the simplest things that can make the most profound impacts. It's just that you have to do it. I can't give you a breathing pill, right? You have to learn how to do this on your own. And so, having these, and it's an interesting thing, and sometimes a little funny when I'm teaching kids and parents how to do belly breathing or diaphragmatic breathing. It's fascinating watching some adults and kids kind of looking at their chests and figuring out their belly, and trying to figure out what should move and what shouldn't move, because we've lost our ability to just naturally breathe, right? We're sucking in our tummies so that we're not pooching out, and we're anxious, so our shoulders are tense, and we're just breathing up in our shoulders with just the top part of our lungs. And so we're almost inadvertently keeping ourselves in a sympathetic fight or flight state by not allowing, this full breathing to happen. So, and there's some other tips in the book, but that I would say is the easiest thing that you can start immediately, right?
Yeah, I tell people this all the time. Breathing is so, like, I use it all the time. I use it first thing in the morning when I cold plunge, because when I cold plunge, like, that's how I make it through. It's shocking. I tell people this all the time. They look at me like I'm crazy. I literally can make my body warmer by breathing a certain way. Like, you can. It's been proven. But then I tell people this too, like, throughout the day. My staff says to me a lot of times, like, how do you remain calm all the time? You're always so calm. Like, doesn't matter what's going on. They'll come to me with issues or patients. I take care of hormonal women, so there are days where people are crying and angry. Um, and they say to me a lot, like, how, my nurse practitioner, my PA will say, how do you always stay calm? And I'm like, oh, you have no idea what's going through my head. No, the truth is breathing. Like, I've learned that, what happens in your life and situation, like, you have a choice of how you react to it. But 10 years ago, and you can ask my therapist, she would tell you I would have imploded. But what I do now is I just breathe, right? And so if you ever really watch me, like, some of the people that come in the room with me, some of the people that help me take notes and scribe for me, they can tell, like, if you're watching me breathing, you can kind of tell, like, oh, she's breathing a little heavier than she normally. Your breath, it is fascinating what it does. And if you, like, I started doing Pilates and yoga within the last year. I'm doing a lot more yoga this year, which is hard for me because it's so slow. But when you breathe really deeply, it's shocking how different your body moves too, right? Like, when you take really big breaths, how much you can stretch out and how much longer you are. And so it's true, and it's all free. And it's just, we forgot how to do it. And you can teach kids how to do it too. And it's one of the best coping mechanisms, is just breathing. So I like that you brought that up too. I have a couple more questions I want to ask you, though, that I know people bring up. And one of them is there any tricks that you have to get kids to eat certain foods or certain food groups that maybe they refuse to eat? So if we have those kids that, have anxiety or ADHD or autism, and they just refuse to eat anything green or any vegetable, is there, like, any sort of tip that you have to help those
Yeah.
parents?
I mean, sometimes, uh, for some kids who have any sort of neurodevelopmental or neuropsychiatric concern, there may be, real sensory issues and oral aversions that need to be worked on. I will give one tip though, across the board. I mean, I'm not going to say every single patient. However, almost all of my kiddos who are very picky, and whether it's taste or texture or smell around food or clothing or sounds like public toilet or the blender, almost all of them will turn around and improve if you give them a little extra zinc, because zinc deficiency or insufficiency can change how foods taste, can change how you process auditory sounds, and can change your whole sensory system. And in fact, I have a friend who, she's become a friend now, and I was down in Southern California doing a podcast with her, and she said that she had listened to me at one point talking about zinc deficiency in kids, and she was like, oh my gosh, I'm checking off the box, each box with my kid. They get sick a lot. They don't like loud sounds. The seams on their socks bother them. They're picky eaters. And maybe they have a little eczema. And so kind of on and on and on. And so she decided to try some zinc, and she bought, one of the over the counter liquid zincs. And she said within 2 weeks, I mean, her kid was eating maybe three different foods, like one brand of chicken nugget and, mac and cheese, right? Within 2 weeks, her daughter was interested in trying new foods, which was that alone was huge, right? Even if it was just like a little taste on the tongue. And she said, after a month, she was eating a much wider variety, even having some vegetables. So now that's a really remarkable, story. But I mean, I hear that all the time, that just zinc alone can make a huge difference. So I would encourage you, if you have kids who are really picky, um, either assess, get blood testing done to see what their zinc levels are, because sometimes it is shockingly low, their red blood cell zinc, or you can always maybe presumptively try to supplement. The reason why I like to check a red blood cell zinc is because, like I said, some kids are very, very low, and it can be surprising how much zinc they need to actually get to optimal levels. But otherwise, you can start, and if you're not seeing a difference, that's when I would say maybe check, because it may be that your kids need a lot more than that. So that's one little pearl. Now, the other thing that, with trying different foods, we have to start where your kids are at. So if your kids are, not having any fruits or vegetables on their plate, well, we still have it in front of them. That's key, because access will increase the likelihood that at some point they're going to try it. We still have it on the table, and we make our meals a little longer. I mean, that's one tip. There was a study that found that just 10 minutes more at the table, not on your screens, right? 10 minutes more at the table increased fruit and vegetable consumption in kids. And so, having it there and just lingering a little bit. I mean, that's one thing that we can all do. The power of the family meal is huge, for self-confidence and even for academic outcomes and healthier eating habits. Um, if your kids are eating a little bit, right? Let's say they like broccoli, right? Well, okay, if they like it raw, then and they like the crunch, well, then we're going to try to move on to maybe a crunchier food, not go from, broccolis to a crunchy raw broccoli to steamed Brussels sprouts. I mean, different flavor, different texture. So we're working on one thing at a time, whether it's a flavor or a texture. Like, let's say they love French fries. Okay, well, let's then try, I mean, right? Who doesn't, right? Or tater tots, right? Let's then, instead of going from that to, a kale salad, move on to, let's try some, sweet potato tater tots, or yuca root tater tots, or, you can have cauliflower tater tots. I mean, just same texture, but now we're moving to a different flavor, slightly different. And it might mean that they take one, like I said, for some kids, it's literally just a little touch on the tongue, and that's all they're going to do at first. And then the next week, maybe they are putting a little bit in their mouth and they're spitting it out, right? And maybe the next week they're slowly
Yeah,
swallowing it. So we
yeah, that
we work
reminds
with
me too.
kids, right?
We have my dad has a long story, but a little girl that kind of lives with him part of the time, and he helps take care of, and she's now almost 4. But whenever we have her try food, we have a game that we play. So, cause she's very picky. So the game is, you have to try it. I don't care how much, how little, but you have to try it. And then you have to give me a up or a down. I want to know, is it good or is it bad? And so that's her thing, is she'll try it and she'll either, or and so that's the game. It's like, you have to try it, and you can either give a thumb up or a thumbs down, but we try it. And so kind of incorporating stuff like that with kids, I think too, is helpful, right?
Absolutely. Yeah. You want to make it, I mean, you will not win a battle around food with your kids, right? So, because you cannot force them to eat something. So, and sometimes it's really, if you're feeling so stressed about what they're eating and food becomes, this awful experience for you, sometimes the best thing is just to completely back off, for a little bit while you work on your own experience with feeding your kid and food, and just really be able to come to the table in a calm way. Because here's the other thing, our kids are so in tune with how we're feeling, especially with their moms, that we co-regulate, right? And so if you are at the table and you're in fight or flight and your heart's racing and you're like, please, please, please just take one bite, their heart's going to start racing and they're going to feel like this is an unsafe situation. And I don't want that. So we have to be able to be calm at the table, not be wedded to any particular outcome in that moment, and know that we're working towards a larger goal. So that's really important. And as you said, we have to make it fun and enjoyable, because I mean, we're not going to, I mean, even for adults, right? Any habit we want to stick, it's got to be enjoyable, right? It's got to be something that's fun and doable and something that we want to keep doing.
Games like that, I think, like we'll play with her, like, okay, well, there's only 6 blueberries on the table, and blueberries, make your skin pretty, make your whatever. I'm going to eat one of them. Okay, there's 5 left. Who wants them? But this is all we have. So, if you want, so like playing games like that, like, are you sure you don't want some of those, because they're kids. But okay, so I think those are great tips. I want to
Well, one thing you just said also is really important. You just said, oh, well, blueberries, they're really good for your skin or whatever it is, right? But we help kids connect the dots. And this is especially important as kids get older, because they're not going to eat something just because we said they're healthy. But wow, if it actually makes them break out less, or it makes them, be faster, on the soccer field, or remember their school play lines better, yeah, then they're going to make different choices because it's actually helping them reach the goals they want.
Yeah. Or do you remember how this morning when we tried to get up and go to school and you were really tired and you didn't feel good and you were cranky? That's because you ate that ice cream last night, like, so good or bad, like relating it back and helping them connect the dots. So speaking of connecting the dots, we don't have to go into a tangent on this, but I want like a 3-ish minute answer or so about, there's so much on the internet about kids and vaccines. And you have this like, no one should ever have vaccines. You have people like, you should vaccinate kids all the time. I think there's probably a happy medium, but what are like, to the people who say like, I'm never giving my child a vaccine because it causes autism or whatever, you're a very well-trained functional medicine pediatric doctor. What is your take in general on vaccines? Obviously we can't talk about all of them, but are you in one of those severe camps, or what is your thought on vaccines?
Well, I think people who gravitate towards me because I'm not on either of the extremes. That really my goal is to empower parents to be able to make an informed decision for themselves and their kids. And I truly believe that parents should have that right. I mean, in some states, they don't have that right. But when it comes to vaccines, there is something called vaccinomics, which looks at it's really a way of looking at our genetic SNPs. We all are so unique in our genetic makeup. And so there's this whole field of vaccinomics that looks at, given your genetic SNPs, how do we make vaccines more effective for you? Now that's vaccinomics. That's what, vaccine manufacturers are interested in. And there are increasing studies on that. There's also another field called adversomics, which doesn't have as many studies, but is very important. I mean, in this day and age where we can do some genetic SNP testing, we need to move towards a point where we have more precision vaccine guidance, where based on our SNPs, we know that your child is the one who is the rare child who is more at risk for developing, autoimmunity or Guillain-Barré or eczema or whatever it is after a vaccine, because we know that these are theoretically possible outcomes. Do most kids have these negative outcomes? Not at least for the short term. We don't know long term, right? But I do think that vaccines can help prevent or reduce the severity of many infections. Not all. I mean, we know that some vaccines just aren't that effective. For instance, in the DTaP combination vaccine, the whooping cough part is highly ineffective, which is why we see whooping cough outbreaks every year, right? So parents should understand that. We also know that certain vaccines, from clinical evidence and also what we can see in the literature, there are, for some populations, an increased risk of developing things like eczema and asthma and allergies afterwards, which is, really high in our pediatric populations. So we're not there yet with adversomics. But I do try to work with families to really understand the family background. What are your kids' risks? Do you have a really strong family history of autoimmunity or atopy, eczema, asthma, allergies, or neurodevelopmental concerns, mental health concerns? And then how do we think then about uh, slowing down the vaccine schedule, spacing them out, maybe considering, really looking at also what infections your child may be at risk for contracting, what other family members may be at risk if your child were to get those diseases. So it has to be personalized, as you can see. Like, I never give a one size fits all answer, because that's not functional medicine either. It's never one size fits all. So it may sound a little wishy-washy, but I have to go with the family, right? And there are some, states like in California where if you want to go to school, you don't have a choice. Your kid has to be fully up to date with their vaccines, or you homeschool, or you move out of the state, right? And for some families, moving out of the state and homeschooling is just not an option. And so then I work with those families to very slowly try to pace it out. And I give kids supplements, before and after, to support their methylation, support detoxification, support mitochondria, support healthy immune response. It's the same thing that I recommend for kids, adults who are getting vaccines, because we want to support all those processes, because we would like, if you are choosing to get a vaccine or you need to get a vaccine, we would like you to have a benefit from it, in trying to reduce the likelihood of that infection, and also not to have or really minimize your chance of having adverse effects. So to say that all vaccines are safe and effective, or to say that no vaccines are safe and effective, are really, I don't see how you can blanketly say that. I think that's a very naive thing to say, and it's not. It's also not good science to say that, and good medicine. It really, we need to take a more individualized
I agree.
approach.
So I'm hearing is individualized care, which I think I agree with that too. But I wanted to ask that because I know that a lot of people, do you talk about that in the book at all? Vaccines? I haven't gotten into it.
I don't really, it's interesting. I actually do not talk about vaccines. I'll talk about vaccines in podcasts, and have workshops around that, master classes to really educate families. But the very sad thing is the vaccine issue is so polarizing and divisive that people make immediate assumptions about, what an individual may be like, a physician may be like, simply by, bringing up the vaccine topic one way or the other. So I didn't want to devalue, all the value in the book for families. And I really also want to make sure that parents, hopefully can find a physician. I know that's hard, but find a physician who can help guide them through making vaccine choices for their kids that they are comfortable with. And also, we need to be educating our kids too, because at some point they become adults who are going to make their own vaccine choices. So it's not something that we never discuss with our kids either. We need to talk to them about really being their best medical advocates, and also how to discuss these things with their
Yeah, no, I
physicians.
completely agree. So I want to kind of transition to the questions that I ask all my guests at the end of every podcast. I appreciate you taking the time to talk to me about all this. Is fascinating. I could talk to you for hours and hours because this is my wheelhouse. Maybe we'll have you back. But just again, I ask everyone this, so don't ever think it. What is one food that you feel is most beneficial and why?
The first food that came to my mind was kimchi. So, fermented foods in general, but I would say, kimchi is really fascinating. In particular, there's actually a Kimchi Research Institute in Korea. I'm Korean, by the way. I grew up with kimchi. Um, but kimchi has been found to kill the H1N1 flu virus in vitro, and so many health benefits of kimchi in particular. Now when we talk about fermented foods in general, fermented foods are really one of the best ways to optimize your gut microbiome diversity, even more than a high fiber diet. Absolutely, we all need to get more fiber in, right? But fermented foods have also been found. There was this one study in young women that found that eating fermented foods significantly reduced their social anxiety. Like that's it. No medications, not even a probiotic supplement, no other supplements. It was simply the intervention of eating fermented foods. So why not? Why not incorporate that into your diet? So, and in my book, I actually have a recipe because I know a lot of parents are like, I don't know if my kids are going to eat, kimchi and yet, right? We always say yet, and they don't really like sauerkraut just yet. But I have a recipe for fermented blackberry lemonade and fermented fruit that you can make. It's a little tangy, but you can use it in your smoothies and, on top of your pancakes or oatmeal or whatever it is.
Awesome. Okay. I've never had anyone say kimchi, so I like that. What is one thing that anyone can do that's completely free that would benefit their health? And I think we talked about a lot,
Yeah,
but
yeah. I mean, we mentioned the breathe. I would say another thing is laughing more, right? Having joy. That's completely free. And, laughing has also been found to improve your heart rate variability. So just, a lot of us when we're sitting, just at our desks or, doing work or reading, if we really stop and paid attention, we're kind of frowning a lot of times, right? And so really making sure you have a soft face and really, have a smile. It changes your brain chemistry just to put a smile on your face, even if you're faking it. Like even if you feel, if you're like, oh, I'm seething on the inside, but if you just make yourself smile, you start to relax a little bit. And so I think having more joy in life is really one of the best things we can do.
okay. And the last question, what is one thing you wish you would have known about your health 20 years ago that you would have done differently?
I wish I had known how important sleep is for my mental and physical and immune health. Um, even through going through, perimenopause and menopause, it wasn't actually hormones, taking hormones or whatever it is that made a difference. It was prioritizing my sleep. 100% I can see a huge difference if I prioritize sleep or if I don't. And honestly, I was hoping that the hormones would be some sort of magic bullet for fixing everything. But it wasn't. It was the sleep. So I wish someone had really showed me 20 years ago. I'm like, wow, I mean, I'm healthy in general, but could you imagine how much better I would have felt if I actually prioritized sleep?
Yeah, I completely agree. Well, Dr. Song, thank you so much for coming on the Back to the Basics podcast and answering all these questions. Like I said, I'm sure that people will have tons more, so we may have to have you back. But if you guys don't or have not heard of her book or gotten it, make sure that you do that. We'll link all of her stuff in the show notes. She has a great social media platform, and I would highly recommend her book. So thank you. Wow. So that interview was packed full of great information. Her book, Healthy Kids, Happy Kids, definitely need to get a copy, you guys. It's such a great book. Even as an adult, there's great stuff in there. So I loved reading it. I'm in the process of making my book. And so it was just a great, reference to go back and see how she did it. I think she did a wonderful, wonderful job. I hope that now you have some answers to some of the questions we discussed. What can we do to make our kids' microbiome better? What sort of foods can we incorporate? How can we incorporate those foods? What do we do when our kids won't eat the foods we want them to? Do we try to nag them? Do we try to force it? What do we do when we feel like our kids are stressed? What are some ways we can help our kids cope with that stress? And so, all these things are very important for building a microbiome. And then, as a parent, what medication should we really try to avoid in our kids? And what can we do if we think that our kids need those medications? So, we just covered a lot of things, which I thought was awesome. And a lot of these things are what I teach you guys with adults. Like, birth control is not the answer. Antibiotics are not always the answer, although sometimes they're needed. We really have to be careful with antacids. Stress and sleep are so important, more so in our kids. But the other cool thing is, I hope you guys took away from this, kids, although they can have dysfunction with their gut and lots of health issues, they are so much quicker to heal than adults. So we really got to grab these health issues by the reins and rein our kids in and really work on focusing on getting them healthier faster, because we can do that. They haven't had as much damage for so long. But there are so many kids out there who are getting chronic illnesses and getting sick. And so as parents and as their caregivers, we really need to be advocating for them. And so I think that this is a great way to do it. So I hope that you found this episode educational. I hope that you found it helpful. I hope that you would share it with anyone that has a child or anyone, that helps care for children, anyone that you think this would be beneficial, please share this episode. Make sure that you're following us. So follow us on Apple, Spotify, or YouTube, wherever you listen to this, so that you make sure you get every episode that comes back. And do me a favor and leave us a review. If you think we're doing a good job, I would appreciate any review, because that helps me know that you appreciate this. Leave comments too about what sort of episodes you would like for me to do on my podcast, either where you find your podcast or on social media. And then please remember that Modern Endocrine can now see patients in 21 states. A list of those states are on our website. We're happy to do telehealth, or you're always welcome to come to our state-of-the-art clinic in Oklahoma City. We provide a holistic range of healthcare, and we are really, our goal is to get to the root cause of all problems. We want people to figure out why they don't feel well, how they can feel better, and how they don't need to, take medications and lean on the traditional healthcare model for the rest of their lives. So make sure that you check us out if you're ready to get better. We do not see children currently. We see teenagers, but we do not see children. And the teenagers, it kind of depends on what's going on, but we are happy to help you in any way possible. And thank you so much for spending this last hour with me. I know that you have a choice with what you do with your time, and I appreciate you trying to become better, become healthier, and be the best version of you. The information presented, including any materials discussed, referenced, or linked within this podcast, are for general educational purposes only, not the practice of medicine. No doctor-patient relationship is formed from you listening to this podcast or utilizing any of the information provided. I am a doctor, but I am not talking to you as your doctor. The information provided is not intended to diagnose or treat health problems, or take the place of the professional medical care provided by your doctor. If you are experiencing any health problems, including problems you believe have been touched upon in any respect within this podcast, you should consult your doctor about the problems without delay. You may ask your doctor whether he or she believes the information I have provided would be helpful to you, but you should still consult your doctor immediately and follow his or her medical advice as your treating physician. I'm just here to provide you basic knowledge about the issues we discuss so you are more aware of them and can better discuss them with your doctor. That's why we call it Back to the Basics. Join me on the next episode as we continue our journey.